Here.
Joliet.
Here.
Lewis.
Here. Thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first order of business is approving the minutes from May 14th, 2024. I have a motion from Commissioner Taylor and support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? Our minutes are approved. Next is approving the agenda. I have a motion from Commissioner Gingell, support from Commissioner Erickson Galt. All in favor say aye.
Aye.
Opposed? Our agenda is approved. We've arrived at our first public comment for items on the agenda. Is there anybody from the public wishing to comment? If so, you would sit at the head of the table and state your name and the community you're from. Seeing none, public comment is closed. We're moving on to communications. There are 3 items under communications. 2 are from Health and Human Services. The first is the Neighborhood and Housing Development Amendment to the Program Year 2021-25 Consolidated Plan for Oakland County, which addresses affordable housing rental. The second item is a grant application to the Michigan Department of Health and Human Services for the Vaccine Champion Partner Mini Grant Program, which seeks to improve vaccination rates. And the third item is the Q3 report from Oakland Together School Mental Health and Wellbeing Grant Funds for Communities and Schools Initiative. Who would like to make a motion to approve communications? I have a motion by Commissioner Cavell, support from Commissioner Taylor. Any comments or questions on communications? Do you want to do all in favor of approving the communication, say aye.
Aye.
Opposed? Our communications are approved. Our first regular agenda item is from the District Court. It's the 52nd 2 District Court in Clarkston, approval of the appointment of a District Court Magistrate, Richard Stranger.
Good morning, everyone.
Good morning. One moment. I have a motion by Commissioner Gingell, support from Commissioner Ann Erickson Galt. And welcome.
Thank you. Good morning, everyone. I'm Brett Derry. If we haven't met, I'm the court administrator at 52-2, which is the court based in Clarkston, which just generally is the entire northwest corner communities of that area court. But more importantly, sitting next to me is Mr. Richard Stranger this morning, who I'm asking the board to approve his appointment for a vacancy for an open magistrate position at our court. And if the board will permit me, I'd like to tell you why he's qualified for it, and then I'm gonna tell you why we actually want to choose him to fill the position.
Happy New Year.
Thank you. Mr. Stringer is a graduate of the Detroit College of Law. He's been an attorney for 25 years. He has experience in almost every area of law I've ever heard of, except for one that we found this morning. But he's a former prosecutor. He's got experience in criminal law, in juvenile law, business, employment. Anything else? Okay.
That's pretty much
Everything. Most recently, we appointed him as defense counsel to our sobriety court program, and he's been serving in that function locally for us at 52-2. And the entire team, including the judges, has been absolutely thrilled with his advocacy and his demeanor in the sobriety court program. It's been very successful having him there, so we've decided to make him do more things, and we've asked him to be a magistrate for us. Also, if you're looking through his resume, which is very long and makes me feel very lazy, you're gonna see he's got a lot of interesting things on the last couple of pages. He has a very interesting athletic background, which people always like to ask him about. And he's also been a volunteer for everywhere? Everywhere.
Mostly March of Dimes and Special Olympics.
And I'm embarrassing right now. He's a very humble man. He's not gonna like them saying all these nice things about him. But that's why he's qualified. The reason why his was the name that popped up, I sat down with Judge Costa and Judge Fabrizio, and his was the only name, the first and only name that popped up. He was the one that we wanted because I've been in the courts for 16 years and everybody knows Rich. And he walks into the courtroom and the day gets better. Things get solved. He advocates for his clients. He's even-tempered. He will babble with me on the side about whatever's going on. He's just the most fantastic person. And when I was telling people that we were looking to make him a magistrate, everybody went, "Oh, he's so great. What a great appointment." So it's for those reasons, not only is he a fantastic lawyer, but he's a fantastic person, that we're asking for the board's approval to appoint him today.
Sold.
And we're happy to answer any questions.
Thank you, and I agree with Commissioner Gershens, and I'm sold on this and happy to hear about the kindness that emanates from your heart too in serving other people. So Commissioner Genzel?
Yeah, I was just gonna say, Mr. Stringer's from the great township of Orion, and so I know him and just wanna vouch for his community involvement. He's a good citizen, a great person, and a great choice, so.
Thank you. Commissioner Cavell?
Hey, I was wondering, so first it'd be great to hear what it was like playing under Bo, but also you went from the prosecutor to Butzel Long to your own office. I guess what inspired those like career shifts? Those seem like kind of big leaps.
Good question. I was with the prosecutor's office. I was working at the county. I was in risk management for a little while and then development and planning. And then I was going to law school in the evening. So when I graduated from law school and passed the bar, I made a lateral move to the prosecutor's office. And I really enjoyed it there. And my wife and I at the time just had our first child. And I got a friend of mine was working at Butzel Long, and I got an offer there to make more money, and we had a little baby at home, and I left for more money, but quite honestly, I kind of regretted it, because I enjoyed the prosecutor's office more than the law firm setting. So then I was at Butzel for 5 years, and I didn't necessarily leave on my own. The economy kind of went down, and they had some staff reduction, and I was low on the totem pole, so they let me go, and that's when I hung out my own shingle. So. And then I started, as a lot of my old friends from the prosecutor's office say, I joined the dark side. So I started doing criminal defense instead of prosecution, so.
Okay, thank you.
Thank you. Anything else? All right, would you prompt the vote, please? Yes.
Yes.
You have 8 yeas, 0 nays.
All right, a unanimous vote.
Congratulations.
Welcome.
Thank you
Thank
so
you.
much.
Thank you.
Welcome.
Thank you.
Our next two items are from the sheriff's office. These two items are acceptances of grants. The first from the Marine Safety Program, and the second is a Forensic Science Improvement Program and funding transfer request. Who would like to make a motion? I have a motion by Commissioner Nelson, support from Commissioner Joliet. And we have our undersheriff and Guy up here to talk about these two good news items, acceptance of money. Yes, thank you.
Good morning. So the first item is our annual marine safety acceptance. It's great that we're getting money, but as you know, we never get as much as we apply for. So we're getting about $173,500 this year, which is $4,900 more than we got last year, but not even close to the $676,000 that we applied for. So it pays for a portion of salaries and operating equipment for the Marine Safety Division. Most of it is a federal award of $141,100. The remaining is a state grant, and then the state portion requires a 25% match of a little over $10,000 that we already have in our budget.
Thank you.
The next item is our annual acceptance of the Paul Coverdell Forensic Improvement Program funding from the Michigan State Police. This year it's $76,960. This pays for a portion of one forensic lab investigator, and then the remaining funds pay for opioid test kits.
Thank you. Any comments or questions about these two items? Commissioner Cavell?
I was just thinking as you were talking, the marine safety, how does that work in relation to our patrols with private lakes? I know we've talked about this off and on before, but can you just kind of explain, there's a private lake that people live on?
Yeah, so those contracts are separate from this. I mean, this funding, basically is reimbursement. It pays for a portion of the program that we have. So The budget for those private ones are separate, so that's a different revenue stream, obviously, that comes in from, we charge them based on what our contractual rate is at the time for marine safety and the hours that each lake wants to contract with. So it's still part of the overall marine budget, but those are two separate areas.
Is the marine safety budget or the marine contract budget, is it the same pay scale and like direct, indirect compensation or contract as the LES contracts with like other townships? Is it on the same sort of fee schedule?
Yes. Yeah, but those are part-timers, so it is different, obviously, there's,
Different amounts.
there's different amounts, and then with marine, we have boat and no boat, so depending on what type of agreement the lake wants, there's different positions and different rates, but yeah,
Okay,
direct costs were included in those list rates.
okay, thank you.
Thank you. Any other questions or comments? Commissioner Nelson?
Thank you, Madam Chair. Well, first and foremost, we appreciate our Marine Patrol and our Marine Division. Can't say enough. I know that we have embarked on the summer boating season. With that being said, do we know the lakes that were highlighted for additional Marine Patrol services with the 50,000 grant monies that this body put together for the Marine Patrol?
I don't know if we have a schedule of highlighted ones, I mean, I think that was, it was based on need, but we can find out from the lieutenant on.
That would be great, because in previous years, there's about 5 to 7
Yep.
lakes that met criteria put forth by, obviously, the Oakland County Marine Division in regards to those lakes that could receive a little bit more patrol based upon, like I said, there's 3 different components of criteria. So when and if, please share
We absolutely will.
those lakes. Thank you. Thank you, Madam Chair.
Sure. Any other comments? All right, would you prompt the vote, please?
Taylor,
Yes.
Gershenson,
Yes.
Yes.
8 yeas, 0 nays.
That motion carries. It is unanimous. Thank you.
Thank you very much for your support.
Our next items are from the Emergency Management and Homeland Security. So 2 different items. We'll take one at a time this time. The first is the acceptance of the Michigan Department of State Police for the fiscal year 2023 Hazardous Materials Emergency Preparedness Planning. Okay, we need a motion. Everybody knows this by now. Commissioner Gershenson, and seconded by Commissioner Taylor. Thank you. And Robert, we have both of you. We're gonna take both at the same time then?
No, that's right. Mike will come up for the
Okay,
second.
all right.
I'll sit in on both.
Okay, all right, thank you.
Okay, so this is for the annual Hazardous Materials Emergency Preparedness Planning Grant. This pays for staff position, partially pays for a staff position, a part-timer that enters information about hazardous materials that are produced and stored in Oakland County by our 672 hazardous materials companies that we have here in the county. That money amounts to $11,520 that'll come to the county with a 25% match from the state that equals $2,880 for a total of $14,440. They also do the off-site response plans for all those companies so that the fire departments know what materials are stored there and then can safely respond to that location if they have an emergency.
Thank you. And how many is your report 262 hazardous materials? What did I
There's
hear
262
this
sites that are covered under this. There's 670, so I think it's 672 sites total in Oakland County that have hazardous materials.
year? Oh, thank you.
There's 2 different, based on what the chemicals are, there's a couple different levels of required response plans and planning. So those 272 are the higher level,
Yep.
require more information.
Thank you. Any other questions or comments on this item? All right, would you prompt the vote?
Nelson,
Yes.
Deval,
Yes.
Erickson, Dahl,
Yes.
8 yeas, 0 nays.
Motion carries.
Thank you, Board.
All Our next item is a creation of a positions in the Building Safety Division. So I have a motion from Commissioner Gershenson and support from Commissioner Joliet. So thank you for staying up here. Welcome. What can you tell us about the positions now?
Good morning, thank you. I think I know most of you, Tom Hardesty, Mike Crum, who's the Chief of Building Safety. So Mike's been with us a couple of years now, a retired Berkeley Deputy Chief, and then also with Oakland University for a few years. He's really spent the last couple of years kind of delving into and evaluating building safety, working with administration on goals for continuing to improve safety for employees and visitors here, but really spent a lot of time looking at it and trying to see how do we get more efficient and improve our service at the same time. So now after these couple of years, with some contracts starting to expire that were in place before, starting to make some recommendations. So I'll let him go into some detail with this one and about what these recommendations are and why we think they're.
Thank you.
Thank you. So this recommendation is specific to our safety equipment on complex, and that safety equipment's the AEDs, the automated external defibrillators, the first aid cabinets, stop the bleed kits, and the striker chairs. That's what we'll cover today. And previously we had an outside vendor that provided our maintenance and our procurement for those equipment on complex. And what we would like to do is bring that service internal so that we can do that from the safety division. And the contract expired on March 31st. We did put out an RFP and got some results. The numbers did jump significantly based on some guidelines and standards, both from IOSHA, the manufacturer, which is Philips for the AEDs, and the American Heart Association, which is the real big one that covers this equipment. And their recommendations and their guidelines are, these are inspected once a month, and previously we were doing that once a quarter. So to do that, the cost did jump significantly. And that's where we think we can do this much more effectively and efficiently with internal staff.
Thank you.
One of the, and part of the reason this goes all the way back to March, they put it out to bid. We really didn't like what we were getting back. The one response, we broke down the bid into more pieces because it's also HR uses some training pieces. So we again broke it out into separate pieces, reached out to vendors, trying to encourage, and still for this portion of checking the equipment, only got one bid. And then the cost to have them do it and do it to the standards, which frankly hasn't been done prior, is over $300,000 a year. So we just felt that it one saves money and we would do a better job by bringing it in-house. But we tried 2 different times to try to get bids and get more people on this, and it's not a field that a lot of them really want to get into with spending the time to come out and look at and walk through the buildings and do that.
Thank you. Commissioner Cavell.
Yeah, cool. Thank you. Well, I like that we're bringing this in-house, and I think that anyone on finance or when we think about budgets, that this being more par for the course for us from now on, I think not only is like a good values thing, because then we can ensure quality and control, but also we can treat these employees better because as you see the step pay scale and all the benefits they get are going to probably be better than a vendor. And then also, like Tom was saying, the contracts are now more competitive thanks to inflation or people getting paid more. So I hope we just stay mindful of this for big things like the Aramark contract or IT contracts, things like this, where it might become cheaper and better quality service to have things in-house for any number of reasons. So thanks for doing the 2 RFPs, but this is great.
Thank you. Anything else? All right, would you prompt the vote, please?
Erickson, no.
Yes.
Cavell.
Yes.
Taylor.
Yes.
Nelson.
Yes.
Hughes.
Yes,
D'Angelo.
Yes.
You have 8 yeas, 0 nays.
thank you.
Thank you.
Motion carries, thank you.
Madam Chair, can I take a moment of personal privilege? I just wanna thank publicly Tom Hardesty for his help with the spill that happened in West Bloomfield. When I got a call about it, I had no clue who to turn to, and so of course I called Tom. And Tom, under the radar, he's not in any press release and neither am I. But Tom really took care of it. He knew who to call, and he has so many good relationships in the community that it really worked out well. And so I just wanted to acknowledge, but thank you for that.
Well, thank you, but I'll say the same thing. It was back to Rob and Darren and the staff at the office that really handled it. So we appreciate that and glad they were able to take care of it quickly.
Thank you. Our next three items are from Health and Human Services. The first is an agreement with Honor Community Health for Pontiac Integrated Health Walk-in Clinic. The second is an agreement with Oakland Community Health Network. Another agreement with Pontiac Integrated Health Walk-in Clinic. And the third is the budget amendment to address public health, literacy, and homelessness concerns in Oakland County. So I have a motion by Commissioner Nelson, support from Commissioner Taylor. And so I would welcome you both to talk a little bit more about these items.
Thank you. Yes, so we'll start with the first two sub-recipients, if that's okay, because they're connected.
Yes.
So we're very excited. I know we've kind of been toting this a little bit, keeping you on pins and needles about the integrated urgent care, but we're really excited to announce that we've actually started a very small walk-in, right, pilot at the site already. And so what we're looking to do now is obviously pay our partners for the work that they're about to do. So that's what the subrecipient is for. If you remember, we brought this grant, we received $5 million from the state of Michigan, actually as an earmark to do this project. And so finally, with lots of hard work with Debbie from Honor Community Health, which I know you all know her, and OCHN, we're able to kind of start our project in Pontiac as integrated urgent care. So those two subrecipients are just to pay Honor Community Health $3 million of that money, and then OCHN to do the primary care, and then OCHN to do the behavioral health side of integrated urgent care. Obviously, Honor is going to handle a lot of the construction and refurbishing, so that's why you'll see a little bit difference, a little bit more staffing to kind of run the site and kind of be our lead agency there. And then OCHN, obviously, as our partner as well, is coming in to provide the behavioral health side. So we have been open for about 15 days.
We have.
So excited. We were so glad we could get this on the agenda today. We want to get them some money so they can continue to move these efforts. So,
Debbie, what are the walk-in hours?
So right now, it is from 4 to 7 during the weekday and then 11 to 5. By the end of summer, early fall, we'll be on 10-hour days. So we'll do from 11 till 9 o'clock at night, and then we'll do from 11 to 7 on the weekend. So if it's okay, I'll share with you just a little bit of what we're seeing in the very small window, because I've been nervous on this one. I'm just gonna be honest. It's one of those 2 a.m. I wake up like, where are we at with this? So just in 12 days, we've seen 32 patients. Now understand, we've done no marketing on this because we really just wanted to get a feel for what this is gonna look like. How does this work? But we've seen 32 patients, 60% of them have been female, 40% have been male, 13% peds and 87% adults that have walked through. 72% are speaking English and 28% speak Spanish. Zip code areas in the primary areas are 48341, 48340, no surprise there, and a combination of 9 and others. This is what I've been worried about, so just a small glimmer, like you just don't know what a walk-in. Keep in mind that Pontiac General stopped their walk-in. So for us, we have a lot of people who are walking in the Pontiac area, the greater Pontiac area, looking for access to urgent care, and that's no longer there. St. Joe's has been inundated, so there's periodically St. Joe's like, we just can't. We're gonna see him, Deb, but we gotta get a different system down. But 66% are insured with Medicaid or Medicare of some sort, and 24% are uninsured, which is not a surprise and actually better than what I thought. So I think as we're looking long-term to change this, that's an important piece. We had one person walk in who say, I don't know where to go, and I just saw this sign driving down the road, and she walked in and we got her access to healthcare we needed to. She had a broken arm, so we had to send her down to the emergency room. Another person who presented with a cough, and we did the PHQ-9, pretty serious bout of depression, so we were able to refer and work with CMH to get that person in. So just to kind of remind you, we are not the mental health provider and we're not the public health provider. So what I think is really cool about this is you have the mental health person. It's not unusual for me to either call McLaren or St. Joe and say, listen, I have a family of 5, I can't get them in right now into CMH because the providers are all booked up. But they're suicidal and homicidal, and I have no choice as a primary care to either bring them in or go to another. What's great is that CMH will be right here in the site, and just even in this last week, when that person can't do therapy, they know people that we don't know. And so they can pick up the phone and call and say, hey, listen, I need to. The goal by July 1 is that CMH will have its core providers in. It's also not unusual for us to call Leanne or her team and say, hey, listen, it looks like we have an infectious disease person here. Can you help us walk through what this might like? So I think there's some really cool opportunities here for a community group that will just get stronger. And right now we're running this through our walk-in clinic that we did for COVID. So we had been operational 7 days a week through that space for walk-in testing and administration, so.
Thank you. The 24% that's uninsured, is it the health side or the behavior side that helps with the
It's gonna
Medicaid apps?
be, that's a great question. We will be contracting with OSHA, and OSHA will be helping us do the applications, because we certainly, particularly right now, we wanna make sure that 24% get insured on it. But right now, we have a community health worker that's working on that application piece. And for sure, everybody should know, no kids should be uninsured in the state of Michigan, none. Because we have a really strong, vibrant health insurance program for kids. So that's a really good thing.
Thank you.
We'll be bringing back the contract subrecipient for ULSA very soon, so.
Okay, thank you. Commissioner Gershenson?
Oh, I just have to thank you, Deb. What a lucky partnership this is for us, because those of you that don't know Deb, when she puts her mind to something, it gets done. And what you've done in the last few years with community health-based services has been really remarkable.
Thank you. Thank you. Well, we love our partnership with you all and the support and the community, and we're excited because we're getting ready to bring on our second year of residents, and this will be a part of their training program, which I think is really, really important. You see a different level of acuity of care walking in through a walk-in clinic, and I think that that's really an important piece. So someday I would love to come back and fill you in on the residency program, because that's always phenomenal. Phenomenal. That was such a wise investment on everybody's part, so.
Commissioner Genzel?
Yeah, I just wanted to thank Deb and Lynn. For years, you've been working particularly in Pontiac, right? Pontiac General Changes, Doctors Hospital going out, the intern program you just talked about migrating. So, you're an entrepreneur, you're adaptable, and we appreciate working with you. And you've done a lot of great things, again, particularly in Pontiac, so I appreciate it.
Thank you, appreciate it.
Commissioner Cabell?
I was curious I know it's early yet, and you indicated some of the, I guess, gaps you might notice of like people being uninsured, but what are other things that you foresee or in your experience just can predict being a need that may not already be filled?
Well, I think one that we're really working with community, like looking at our TTS program, you've heard us talk about that, is how do we connect people with resources that they need before they walk out the door, right? So a lot of times they get a paper referral and say, hey, call here. Our goal is to make sure that those needs are met, right? Maybe they walk out the door because they've got to go somewhere else, right? They got to take care of it. You already have families, but we're going to make sure we do that 360. We're going to wrap around services, call them back, and make sure they've been connected to those services. So we're really hoping to get community health workers, that'll be coming soon, and being able to get them out in the community here with integrated urgent care in other areas of the county, really working to connect those services, so.
I think one of the other unique, we don't know what we don't know, and actually that's a great thing. I kind of say to everybody, we want it to bubble up, like I don't want it to stay quiet. Whatever those are, let them bubble up because we're a system and we address that. But there is something that I think is really different about this program, and just the last week and a half I popped in and there's just a different feel with this group of people because they're huddling. So an hour in the morning is to huddle and review what happened last night. What I think could potentially happen, Commissioner, is we get somebody in at 9 o'clock at night and suicidal. Well, the primary care team can't take care of that individual, but they're not gonna let that person go. So if I got a CMH partner there who knows all the core providers, because that's not us and we don't have an interest in being a core, we're primary care services. So that huddle of a community mental health, of a public health person, of a primary care person, then we can have a system to be able to say, to call and say, okay, this person needs to be hospitalized, and where do we do? Because that's a large part of the reason why the urgent care shut down at Pontiac General. They just didn't know what to do, and then you send them to the emergency room around. That's not a wise investment on any of our parts on that. So we can do better on that and understanding, and that's what I like. So we're huddling in the morning to talk about the night before, that wraparound service. And we're huddling at night to say, what do we do with the patients and what are we set to do as a team? And that's, for me, like when I retire, that's what I want to do. I want to come and do those huddles. Like everybody's excited about it. So I had somebody from CMH who, she's young. She's, like my kids. She's like, I have pink hair and I've got a little different, but I'm really committed to this project. And I'm like, you are gonna fit in perfect here. Like, we need that energy, we need that thinking through and helping us connect. Because I need our docs and clinicians doing what they do best, which is see patients on that. So I think, Commissioner, that's what we'll see is more acute mental health needs, and we're gonna have to figure out so that the hospitals, the ERs aren't absorbing those costs. So that's how we're gonna bring down those cost pieces. But there is a significant number of people walking out there trying to figure out where do I go for urgent care who don't know where to go and don't necessarily want to go to the emergency room. And that's a good thing.
Can we ask one more?
One more.
Are hospitals receptive to this? Because I and Medea and I have both talked to like Corewell several times, and they can't find money for inhalers for harm reduction or whatever, but you're helping them like save money, right? If you're helping divert people from the emergency room that are having a mental health episode.
I think we should say what Trinity Health has been with our team from the very beginning. McLaren has been on many calls with us, very invested in this, so I know you.
And I think Shannon from Trinity Health has been a really big part of it. She's a passionate advocate for mental health, and she currently also is the chair for the Michigan Hospital Association board. So I do think the hospital want us to do this because we can hit the problem upstream.
Yeah. But are they open to like giving you or us money? Like, I want people to do stuff for me too, but I don't want to pay them, Like, do they also, are they open to that?
I think, Commissioner Cavall, what I would say is that the huddles that Deb just talked about, this is a SAMHSA evidence-based model. If you look at the PBHCI work, that's how it started. So I think there are many sustainability options, and having a hospital on our side will really help us.
Cool. Okay, thanks.
Commissioner Erickson Galt.
Yeah, I just kind of want to piggyback on what you were saying, and it sounds like what you're doing here is you're filling a gap. You're not necessarily competing with the hospitals or any other providers. You've identified a gap in services, and you're providing it in the primary services and the services that are not within your core function. You are connecting people to those services. And I think that's great, is to, what we can do best is to fill those gaps as opposed to, personal experience, I know emergency rooms are overloaded with people who are having mental health crises. And so anything we can do to take that out of the emergency rooms and connect them with providers that can help them. That's great.
Yeah, and that's the intent of this project, and we're seeing that happen. And I think, you know, what is unique is your Medicaid and Medicare population. If you're looking at Pontiac area, that is where your largest group is. It's also the group that can also, the hospitals don't necessarily get their costs back on that very population. So that's the reason why this is a good investment in there, because it opens up capacity for others to be seen in the emergency rooms, so.
I think it's an amazing project. It's an ideal situation, bringing everybody to the table. In reflection, it seems like a simple solution, but not. It just took so long in coming, and I feel like 2024, we made it. This is good news.
We did it.
We did it.
We did it.
Yeah.
There's one missing, OCHN too, so.
Yeah. So thank you. Yeah. Any other comments or questions regarding this particular item?
Great team. This is the dream team, I have to say. These ladies inspire me every single day.
Thank you. All right, the next item, the budget amendment for public health, literacy, and homelessness.
So this is quite a few initiatives, right, rolled into one, but really focused on public health, right, human services, whether we're talking about Children's Village, right, and looking for a literacy program for the staff. We've had 2 new legislative items that have come through around lead in kids. So this is something we've been hoping would be coming for a while. There's 2. One, they've reduced the level that's considered an elevated blood level in kids, which is 3.5. So they've reduced that from actually 10 and then 5. And then also there's a new mandate that requires all pediatricians that see a child to test at least once, which is new. So we're waiting on the rules specific that come out, but what we're trying to do is plan ahead, because what we have seen in WIC is, because a lot of times people will come in and they'll get a foot prick, right, and we'll do some basic lead levels, but they need to get a confirmatory test. And a lot of times they leave our WIC office and they don't do that. 1, maybe they don't have a pediatrician that they can do, get to access-wise. 2, just don't follow through, right? We're busy. I understand that as a mom of a small child, right? I mean, it's just tough to do. And so for them to get really help in their homes, right, for us to do investigation, we need that confirmatory test. And so what we're looking to do is purchase equipment, right, that we can do directly in our lab. We can draw the test directly in WIC when they're there, so we can get the confirmatory test, so we can ensure that these individuals and these families can get the investigations and help that they have around our nurses coming into their homes. So that's another piece. We're also expecting that now that we've dropped the level to 3.5, that we're gonna see additional elevated blood levels in kids. So not only are we gonna have to go out with nurses, our environmental health staff, we're expecting that they're gonna have to go out. So we're asking for a secondary XRF machine that tests the paint in homes, right? So we can determine if that's where the elevated lead is coming from. And then the last piece that we're asking for, which we love to talk about, is our affordable housing and our homelessness initiatives. And so we are also asking for some money to purchase some convertible sleeping bags, right? So they're coats that can also be converted to sleeping bags. This is a pilot program that we're really looking to work with our harm reduction team, which are out on the streets every single day, really working with this population. And then also we're asking for some additional money for shelter capacity. We all know our homeless shelters are full and they stay full on a daily basis. They may have 1 or 2 that leave a day, and there's 5 or 6 waiting to fill those spots. Now, we are working to increase the capacity, which, there is a project that we're working to add shelter capacity to each of the shelter homes, our shelter locations. But that's gonna take a little bit of time, right? You can't build buildings in days. So you recently allocated some money toward emergency shelter, and the money went very fast. And I will let Khadijah really talk about the statistics, because that's why we're coming back knowing we need some additional funding for that.
Yes, I want to thank you all for that allocation. We use that funding for emergency shelter expansion this winter. Of course, the idea being just to make sure during the coldest months, our most vulnerable had additional capacity and space to be sheltered until we could get kind of through that winter season. And so we used that allocation of $150,000 to get through about 12 weeks of time during the coldest months. You guys probably remember that horrible cold spell and a polar vortex that happened in January. And so we had 129 unduplicated people who were served in that emergency shelter expansion through hotels or other capacities that we were able to utilize. And in addition to the 129, there were connections made even with those who were not maybe able to be eligible of over 1,475 to other resources. So maybe they didn't qualify at that time for that emergency shelter, but still connections made. So, we have great data. 31% of the individuals that have identified themselves as homeless also identify as having one disability. So just, it's a vulnerable population. So we appreciate that funding and would like to request additional funding to get through our next cold winter season as we continue to build out shelter capacity.
Thank you. The Welcome Inn, presently a day program located in Royal Oaks, has a building that they're looking to sell the building. It's presently owned by Presbytery. Is that something you would consider? Because that would certainly be able to expand homelessness, because that's been their focus for years and years. And the volunteer in the congregation has increased their stance, but spend so much time now on homelessness, and so that's what it's turned into, a homelessness effort, and by everyone there, and they're doesn't have enough congregation for the church to remain.
Yeah, absolutely. We actually were out there a few months ago, and that is one of the shelters that we're working with this upcoming project around building out. So, nothing's broken ground yet, but we are working with them to look at shelter expansion in that area because it is a huge need.
Thank you. Yeah. And my second question is related to the literacy program. So in Oakland County, we have Oakland County Literacy. Are you working with them?
I'm gonna bring Mediha up because this is a Barb project. She wasn't able to make it with us today, so.
Children's Village in specific has a 90% literacy gap. If you look at all of the other Waterford schools, that is a insanely huge gap. And yes, they do go to school during the year, but our goal was, we know that the Children's Village residents are at least 2 grade levels below where they should be in reading. So we wanted to use the summertime to kind of pilot and do some sort of a literacy program that can help bump them up. Use a program that's like 7 or 10 weeks long, and then by the time they're done, they are at a at least up to par or at a higher literacy level. So.
Thank you. So that brings about, in this committee in the years past, we've had a couple of presentations about literacy and the various programs, and they sounded like they were good programs. I wonder if they'll apply.
Yeah,
So my last question is, when is a health fair scheduled to date, and where would it be?
So we're still working on the dates, but our plan is we'll be doing them in August, so we wanna do them prior to school. And we're gonna have, like I said, this is Health and Human Services, so we are gonna explore anyone that wants to be there to talk about their services, right? I think what happened during COVID, we got very focused on just COVID, right? And so there's so many programs and services that we need to remind people exist, because we have a lot of gaps we want to fill. And so our goal is to remind people of everything we do, right? Not just COVID, because we're kind of stuck still in that bucket. Not that we didn't need to focus on COVID, because we did at that point, but just to remind, right, what we do here at the county. Our goal is to partner with parks, right? But we're also gonna bring in housing, right, to talk about the programs that can be offered there. So our goal is
hair salon. That's another thing was hair salon. So in my previous agency, we did like health fairs where we gave haircuts to the kids at the, like you would get volunteers. And I think that's how you make health fairs sexy, to be honest. Like, you wanna be able to get the kids there, like, do things that will bring them there so that they can, while they're there, do all the other stuff.
And we wanna do park location, so we're still working with, we're gonna do it in Pontiac, but we're also gonna do it at Catalpa Oaks. So we're right there in the space and people can see where we are, right, get to appreciate Catalpa Oaks as well, so.
Thank you. Commissioner Cabral?
For all of these, one, it's kind of scary to see like the lead level stuff, the lack of literacy, the homelessness issue. Will, I don't know a fancier way to say this, but like, will this be enough money to structurally solve these, or this is the part one of a 5-phase plan, or like, thinking about budgets coming up for all of us, right? Like, should we look out for hopefully what would be a suitable amount of money to address these structurally, if this does not do that?
These are pilots, right? I think that's a good point. We may need some positions, especially around the lead, right? We know we're gonna grow. We expect, right? We do around 14 to 20 lead inspections right now, right?
Okay.
That's about 1 to 2 full-time people right now, right? We know that that's an issue. So in the budget year, there could be some requests, right? Because we do know this is coming down. And we could do upward of 100 inspections or investigations. And so we just don't know what's coming down. We hope we do more because that means we're identifying it, right? And we're in the homes and making those referrals and getting that help to that family that's there.
So 2 questions to that. The lead, you said 14 to 20.
Yep.
What is that time frame for those numbers? And then second, is that what community health workers can do, is help connect people to service? Is that part of that plan, or is that?
Yes, generally, the way it goes in, so when we get a notification of an EBL, whether it's internally or we get a referral from someone, we have a nurse that goes out into that home, right, to try to identify. Sometimes it's as easy, it's a spice, right? It's there, it's obvious. Sometimes they're not sure where it comes from. So our environmental health is then called in to do a full inspection. Time frame, I don't know. I can ask. I know the nurse gets in there as quick as possible.
Well, I meant, you said 14 to 20
Yeah, that's a year.
assessments.
So
Okay.
that's a year, right? And again, it's all based on referrals or being, we're notified from the state, right? If we get a state lead result, then we call that individual immediately. And so then the EH goes in, they identify, most of the time, like I said, it's paint, right? It's a spice, it could be makeup, right? So they're trained in that area. And if it needs abatement, right, then that might, we might bring in our friends here at Housing, right? Because they have the HIP grant that can help pay for some of those things. So, and then most of the time we continue to monitor the kid, right? They get monitored for blood and we see it come down, or we stay in the house until we're figuring out what that is. So, yeah.
Okay, thank you.
Commissioner Joliet and then Erickson Gold.
Thank you. First of all, the literacy, I think that's great. The Children's Village kids are way behind, and what a great use of time in the summer and to get in there and be preventative, so when they do go back into the community, they're at a higher reading level. My question is about the bill for the lead. So if I'm interpreting this correctly, this request is based on anticipation of this bill. Do you know where the bill stands right now?
So it was passed in 2023, and now they're just writing all the individual rules, right, promulgating all the rules behind it. So it's there, it's mandated, it's in place, yes.
Okay.
We just have not adopted it here yet for the 3.5, and so that's what we're doing. We're adopting it as a 3.5, so we will start doing investigations in the home. And basically immediately is what we're trying to do.
So you know that this 3.5 is the new metric
It is,
that was
yes.
part of that?
That's correct, yes.
Okay,
Yeah.
all right, thank you.
Welcome.
Oh, thank you. I'm very excited about the health fair because reading some of our earlier materials, you have a grant where you are going for trying to get funding to improve vaccination rates. And I was startled to learn that we're only at 35% complete vaccination for adolescents. And that statistic just kind of hit me upside the head. I thought that is a pandemic waiting to happen.
Well, and again, so that's Oakland County, right? So that's really why we're trying to focus our own efforts, right? Getting out to pediatricians, right? Again, I think COVID, for a while, we saw that number drop because people kind of stopped going to the doctor, right? They weren't going, that there was an access issue. The other issue is not every pediatrician carries vaccines now. It's very expensive, right? Because you have to have special refrigerators and freezers. So it's not a cheap, right, endeavor when you're a pediatrician because you have to monitor it on a 24 hours a day. That vaccine has to be monitored, right? If it dips in a certain level, right, sometimes that vaccine has to be thrown out, right? So it can be a very expensive endeavor. We've seen pediatricians shy away from it, which means we're covering that gap, right? Making sure we're getting into those communities to ensure that there's vaccines for kids. So we have definitely seen an increase in our own clinics for vaccine requests for children because it's not as readily available in the community. So you'll see us out in the community a lot more. We are not expecting people to come to our doors anymore. We have a full team that's actually in the community almost on a daily basis doing some kind of vaccine clinic, whether it's homebound, right? So we're even working homebound, going into people's homes. We can bill for that, right? Which is nice. But really, how do we focus on some of those very vulnerable communities where there isn't access, right? Maybe aren't really trusting working with partners like El Centro, right? Culturally based agencies to get into their communities to try to vaccinate as much as we can. So we know it's a growing issue, right? That's why there's a big focus on it, and you'll see our vaccine rates are higher at Oakland County clinics than it is just about anywhere in Oakland County.
What I'm hearing you say, and correct me if I'm wrong, that it isn't necessarily that people are refusing vaccines. It's a question of access and perhaps just
Trust as
yeah,
well.
trust.
Yeah. So
Trust, but trust not necessarily being anti-vaccination. They just maybe need to know that, they need to understand what the importance of it is.
I think there's still a trust,
Yes.
right? And the fear of vaccinations, right? I think there's, with COVID, right, people have had a few more fears, right? They may be spreading out their vaccines. So it may not be that I'm not gonna get it, but if I'm supposed to get 4 today, right, I may say as a parent, I don't want my child to have 4 vaccines today. I'm gonna spread them out over the next 4 appointments. So when it's reported, it looks like that child may be between, because a lot of times it's reported by cohorts, so 36 to 48 months, because they were supposed to receive certain amount of vaccines during that time. They did not receive it during that time. We don't see a lot of the catch-up statistics, right? So they may not get it until they're 5, right? But they actually end up receiving it. It's just not happening at the time that they're recommending it as CDC.
parents are also the ones that have not vaccinated their children are worried they're gonna get into trouble or, so there's that factor as well. So trust works both ways, before the vaccine or even when you're ready to give the vaccine.
Thank you.
Any other questions?
Can I mention something?
Of course,
Thanks.
maybe.
Well, I've done like shadowing or spending the day with the harm reduction team, which I think your staff would be open to doing for anyone else.
It's the best.
It is
It's the
awesome.
best.
Yeah.
Yeah. Part of what we did was go to the Welcome In with Ben. So one, can you share a little bit about that, or you talked about the nurses being out in the field? Can we shadow them?
Yes, definitely. We have staff that are, like I said, daily in homes, right? If you're interested in going to a vaccine event, right? People that are doing homebound, if you just reach out to me, I'll connect you and you can show the services. But I think the harm reduction, if you haven't had an opportunity to go to their office, it's downtown Pontiac. We have a storefront, right? That's only a couple years old. I suggest you go on a Monday. It's unbelievable. And we have individuals that work for us that have lived experience. The individuals that walk in the door trust our staff, I think, more than I've ever seen staff trusted across public health. It's amazing. And then we have a new van, which is going out that actually has a bathroom in it, right? So we can provide additional services that we haven't been able to provide in the past. We can do vaccines because our staff can wash their hands out of that van. So it's an amazing opportunity, and if you can do it, just reach out to me.
I think I'll say, like, I went on the van on a Wednesday and we went alongside 8 Mile. And you realize that the harm reduction van is so much more than harm reduction. I think a lot of the work, which I was very impressed by, is wound care. You know, people that have wounds that come in, and I remember this guy coming in, and he's clearly been there like several times because he knew, you know, Maurice by first name. He's like, hey, what's up? You know, he walks in and he's like, hey, I fell down and I scraped my arm. He pulls his arm. It's clearly an injection site wound, right? And Maurice could say, hey, this is an injection site wound. He didn't. He said, oh yeah, you look like you got scraped up pretty badly, and then starts cleaning him up and talking to him about looking for red dots, which is what happens when xylazine is in the substance you're using, right? So in a very non-stigma form, he's destigmatizing the care so that these folks can come and take the care and not have, like, you know, end up in the hospital needing like arm cut off. What is it called?
Amputation.
This thing. Yes.
Which is why this was kind of started, because people were going to the emergency room or were not going, and they were getting, I mean, severe infections. And then Dr. Faust was seeing them, and he's like, I think we need to get in front of
Like
this,
necrosis.
right? So necrosis,
Yeah, like dead body parts.
Yeah.
Thank you.
I'm really excited for the public, man. I'm like,
I went from the health fair to necrosis. Welcome to public health. That's how it works. So.
Well, on a $40 million budget, right?
On a $40 million.
$40 million.
I was just gonna ask, like, what are you guys doing for lunch? Like, hang out and talk
We
more.
don't want to have it's Doritos. That's about all we eat, right? We'll talk about food service at another time.
lunch with Leanne, because she knows all the restaurant history.
Oh.
We're ready.
Cavell.
Yes.
I don't think you're gonna come from you, no. Taylor,
Yes.
Erickson Dahl,
Yes.
Pearsonson,
Yes.
Nelson,
Yes.
Joliet,
Yes.
Gingell.
Yes.
You have
Yes.
8 yeas, 0 nays.
Thank you. Motion,
Thank you
three
so
motions
much.
carried, thank you.
Appreciate it. Yes,
Thank you.
We'll tell you about the health fairs. We'd love to see you all there.
Keep up the great work.
Yeah.
I wanted.
Our last regularly scheduled item on the agenda is a public service recommendation from our animal shelter, a gift acceptance. Let's have a motion by Commissioner Gingell, support from Commissioner Nelson. And we have our animal shelter staff here. So we can end on a good note. And thank you for staying with us. So, what would you like to add about this item?
Sorry, I thought you guys had to do other stuff. A lot of new faces. I haven't been over here in a while, so I'll introduce myself. I'm Joni Toole. I'm the chief at the animal shelter. And I am here to seek your acceptance of a grant, a very generous grant from the Bilko Family Trust of $10,000. And this is in memory of Tatum Eatson. Tatum Eatson was an employee with the animal shelter. She came to us in 2016. Hardworking, reliable, her love of animals, it was a perfect fit. And sadly, in 2020, Tatum committed suicide. I'm sorry, I'm so sorry. This is her mother, Melissa, and her father, Chris.
Thank you. Oh, thank you for coming.
But I wanna honor these guys. I'm gonna have a hard time with this. She pulled herself together after all that. I don't know how. And since then, she has been having adoption events. And now I can't see through my tears.
I'm a minister of music at the First Congregational Church of Royal Oak. So I started holding pet adoption events in Tatum's memory with awareness of suicide. We also partner with Welcome Home too, so we're involved over there too, which you were talking about last time. But I've done concerts to give them jackets and all that stuff. But yeah, so.
But I mean, she's raised money in honor of Tatum to help the animals at the shelter. I want to, because I know Mr. Belko is watching, he said he would
Yeah, he's
probably be
watching.
watching, so I wanna thank him very much for his generous donation in honor of Tatum. And if you guys come over to the shelter, hopefully you'll come into our lobby and you'll see there's a dog on the wall that's dedicated to Tatum. It sits there and we look at it every day and it reminds us to maybe say a kind word, say how much you love someone, so that you just wanna let people know that you're there. So,
What a nice way to honor her and her memory lives
Very
on
nice
Last
every way.
year's event was very successful, and so we're doing it again this year, July 20th. So if you guys are in
Where is
Royal
it?
Oak.
Royal Oak.
At First Congregational Church of Royal Oak, we'll have vendors there, food trucks, bands, live bands. We'll have pet adoptions going
Yes,
on
pet
with
adoptions.
Oakland County.
Yes.
We'll have classic cars, all kinds of stuff. Blessing of the animals, so if you, and dogs, animals are welcome on
Yep.
leashes, yeah.
I also wanna mention that Tatum was a gifted artist as well.
Yes.
So there's
I'll be
there's
selling
art,
shirts.
yes,
yeah,
art involved in this as well, and her love of animals, and those were two of her favorite things, so, and you know, we miss her very much, and this is a wonderful way to honor her. And I wanna honor this lady for all the hard work she's done for the shelter and for all the good that she's done for the animals at the shelter.
Thank you so much.
It is a nice
Thank
way
you.
to show your love for your child.
Never
And
thought
then
I'd
it
cry to
continues
work.
on.
She was just a very special person.
She was a very special person,
Yeah.
very special.
July 20th at the
July 20th.
Congregational Church on Crooks.
Congregational
Crooks and
Church
Webster.
on Crooks and Webster.
I'll send you, yes, I'll send you guys
Okay.
the flyer for that, yes, but yes.
I've always been, I want to say, I have been to that service a few times.
Oh.
I love the music. It's where the Boy Scouts meet,
Yeah,
so.
Troop 1610.
Yes.
Yeah. Well, I do all the music there, so that's me.
Very nice, thank you.
Yeah, come and check us out on a Sunday morning.
Right, any other comments, questions? Commissioner Cavall?
This is
I'm-
my-
I'm
Sorry, this is
Okay.
Tatum's
Tatum's
dad.
dad,
Tatum's dad,
Well,
Chris.
thank you both so much for sharing.
it's all her. She works tirelessly.
She does.
Well, I was gonna ask, can you tell us about Tatum a little bit more? We heard about music and pets, but.
You might be better, I don't know what you do.
Tatum was a very precocious kid when she grew up. I think she got her love of animals probably from me, because whenever I see a stray on the street or something, I try and make sure it's taken care of. In fact, the last one, it's kind of funny, I was getting off the freeway and our wonderful roads. I was literally parked next to a car waiting for the light to turn green, and I looked down between the cars, and in a crack of concrete was a baby kitten.
No.
And the driver next to me is pointing down, and I'm, okay. So I got out, I drove a work van, so I got out of my work van and picked the cat up, put it in the work van. I said, I'll take it home. Tatum will take care of it. Don't worry about it. She'll find a home for this animal, no problem. The cat disappeared in my van.
Oh, no.
Literally could not find this cat anywhere. I'm like, okay, because I made a couple business stops and like maybe it jumped out. The next morning I started the vehicle and meow. There's a cat in my van still. It had crawled up under the dash, laid on top of the radio inside the dash. Proceeded to take me 3.5, 4 hours to get that out. Tatum had that cat adopted within 45 minutes of me finding the cat. And that's just the way she was.
She lives 2 doors down now.
Yeah, the cat lives 2 doors down. But she never gave up on any animals whatsoever.
Our house was like,
Our house was a halfway home for baby kittens that couldn't be weaned off their mothers yet, or puppy dogs, or, yeah, it was always interesting coming home from work because there was always an addition to the house. But that's kind of what makes life fun.
but her love was, or I should say her passion, was art. So she wanted to pursue her art degree, which she got a fine arts degree from Kendall. And so she wanted to have that completed first before she did her, what she classified as her real job.
Yeah.
Because she was accepted into the vet tech program and yeah, that's she had just started and that's when she lost her life. Her boyfriend,
Tragically took his own life
5 months prior.
and absolutely wrecked her.
Yeah.
So sorry for
Heavy
your loss.
burden.
Yeah.
So,
But yeah, she's just an amazing.
so when we hear about your
Process.
adventures with the mental health, which we were just privy to, I can't tell you guys how much the hospitals absolutely hate dealing with that stuff. So any intermediary program you guys can come up with, I think is well worth the time. It's well worth the time and the effort.
Family Against Narcotics will also be at our event, and we'll have NAM there too, so they'll be reaching out. And then local suicide group called Kevin Song, which is in Grosse Pointe, will also be there. And we have in the narthex of the church, we set it up really beautifully last year for remembrance. So we asked people to bring pictures of their loved ones. There's candles to be lit and material available. And it's just a place where you can come together and talk to others who have lost people, loved ones to this. So it's for survivors also.
Thank you. Commissioner
Are
Gershenson?
you familiar with the Friendship Circles program on social anxiety? Okay, so maybe I could make that
I've read a little bit
connection.
on it.
Yeah, I mean, they're all welcome. This is a huge community outreach. Yeah, that's why we're doing it.
Right.
And the church right up the street you were discussing before too, possibly buying for a homeless shelter, would be a good investment. Would be a really good investment.
Yeah, we've done our past
We've-
Christmas concerts and we've collected
We
coats
volunteered
and-
there before as
Yeah,
well.
and jackets and all that stuff to help them. Yeah. Our church is really affiliated with them too.
Yeah, thank you.
Mhm.
Yep. Our goal is to make a positive difference in the lives of others. and
You know,
we can do it
sometimes
one
it's really
person at a
hard to
time.
do the right thing, but you
Yes.
guys seem like you're on the right track.
Thank you. All right, would you prompt the vote?
Sorry, right?
Yes.
Yes.
Joliet,
Yes.
Nelson,
Yes.
Gerson.
Yes.
You have 8 yeas here, please.
All right, motion carries. Thank you.
Thank you.
Thank you.
Thank you very much.
Thank you.
We'll get a flyer to you guys,
Yes,
all right?
yes.
Come and check us out.
Yeah. Our last item on the agenda is public. Is there anyone from the public wishing to comment? Seeing none, public comment is closed and this meeting is adjourned at 11:58. Thank you.
Wow, what a
everybody.
mission.
Good job.
So happy duty.